I don't want to go into too many other topics. We'll take long, but BMI sounds like a bunch of bullshit. Like, I'm overweight on the BMI, and I'm not saying I'm skinny, but
I've been obese on that scale since I was like grade 11. And
it's crazy though.
And you're an athletic hockey player.
And I used to be like super ripped. Like,
no,
and
BMI
I was
is
still obese.
BMI is not a great measure of
because it's
anything,
two numbers, weight and height, right?
It's height and weight. It doesn't consider your body proportions.
Yeah.
It doesn't consider, like, you can have a person who has like an amputation and weighs less.
Oh yeah.
You know what I mean? Like,
that's actually a good point.
It's the weirdest calculation. So what I do, we use BSA, which is body surface area.
Oh.
So it's a different calculation.
Okay. BSA.
Yeah.
Damn.
Which is not, it also does not take into consideration muscle and fat. But it's a better indicator for like someone's cellular size.
Yeah, that makes sense.
Yeah.
Because muscle's more dense, so maybe you kind of counteract the surface area a bit. Because if you're more muscular, maybe not as much surface area. No?
Not really. Probably.
Okay.
It's more just to do with like safe dosages of stuff.
Oh,
of what a typical body can metabolize.
How hard are we going to fuck this guy up?
Pretty much.
Okay.
Yep.
That relates. So you've been a nurse for a long time. Nursing's been part of your life since the teens, since you went to school?
Yeah, since I went to school. So I started university in 2008. So 10 years.
Wow. Just quickly though, why nursing?
That's actually kind of funny. My intention was not to be a nurse at the beginning, actually.
Oh, really?
So in grade 11, I got offered this opportunity to do an internship with, at the time it was Calgary Health Region. And so you just put your application in. They selected 100 students in Calgary to participate in these different internships. I ended up getting a position on a nephrology, so kidney disorder floor at Foothills.
Thank you for clarifying.
Yes. I was like, I don't want to get too jargony, Andrew.
I might ask you a lot to define a lot of words.
That's okay. There, I'll try and incorporate it in. So
if you said stuff
kidney
about
disease floor. Yeah.
If you said stuff about tech, I might understand, but medicine is...
No.
Yeah.
And vice versa.
Exactly, yeah.
So I ended up getting this position, and my intention was I was going to go to med school.
Okay.
I always thought that I was going to be a pediatrician. That's what I always thought that I was going to do.
Okay, so that was your first idea.
Yeah.
Okay.
Yeah, so when I was 16, 17. And then with my role, which was very insignificant at the time, it was just like stocking shelves and some other kind of dirty work and stuff. But I got to see the interaction of the nurses with the patients and the role that they played.
Right.
And this wasn't even to do with cancer, but it was just nursing in general. And I liked that role a lot better than what the doctors did.
Oh, okay.
And that completely changed my mind. So I went to nursing school with the intention of maybe continuing and going into med school after.
Right.
But knowing that it would lead me to a great career anyway.
Okay.
If I decided. But it took me like a month of nursing school to be like, yep.
This is what you want.
This is exactly where I want to be.
So the difference there, maybe if I understand you, is that you want to be face-to-face with people. Was that the difference?
Yeah, pretty much. So the nurses knew their patients. It was actually one specific situation that I still remember exactly what happened.
Oh, okay, yeah.
And it was basically a patient had something go quite wrong, and the nurse was able to tell you exactly who this patient was, what their diagnosis, what had been going on leading up to this event. And this physician, who was probably a resident, so didn't know maybe as much as they would now as a staff doc or whatever. But the resident didn't know what to do, and the nurse basically saved this person's life because she took it into her own hands and was like, we're going to do this, we're going to get fluids going, we're going to give them blood, so on and so forth. And this person ended up living, and the doctor stood there kind of with a blank stare and had no idea what was going on.
What, really?
And that was like the moment, because I happened to be walking by this room when all this was happening. And that happened to be the moment that I was like, I would much rather be that nurse who knows this person and knows their family and knows everything about them,
and
as opposed to a physician that sometimes gets called into these situations that has to deal with a scary event or an acute incident that goes on and doesn't know this person from Joe Blow.
Right, exactly. So you're really close with that with the people that you take care of.
Yeah.
And really, I'm not saying doctors don't care, but you really care because it's a face.
And the doctors do definitely care when they are given the opportunity to get to know these patients.
Yeah,
exactly. But when you're walking into it blindly, like you can't expect that much. But the part of this that drew me to nursing was that I wanted that relationship with a patient. I wanted to see them as a human being. I wanted to know everything about their story and their history and their disease process, and to be there. Yeah. Like, be that advocate, be their support person, be their teacher, be whatever I needed to be.
Awesome. Okay, that makes sense. And then, and correct me if I'm saying this wrong, you went into oncology, or you're an oncologist, or how do you...
I'm an oncology nurse.
Oncology nurse, sorry. Yeah. Okay. So there's many avenues of nursing. Yeah. Oncology is one of them. And oncology, is that specific to cancer treatment?
Yes.
Okay. So why oncology?
So I also kind of fell into that by accident.
Oh, okay. It's like many things in life.
I was convinced that I was going to work in emergency or the intensive care unit, something at the time that I found was like hardcore and exciting and you know, kind of the badass nurse that I wanted to be.
The front lines.
Exactly. The really like intense stuff that you think of. And
you're in the trenches or...
absolutely. So totally. That was always the goal. And I actually even got like a Christmas ornament one year from my mom before I graduated nursing school. And it had like a little scrub shirt, like a top. And it said Trauma Queen.
Oh, really?
On it.
So everyone thought you were going down that path.
So everybody thought that was the way I was going. Yeah. And I ended up doing my final placement in university. So in university, in fourth year, for the 4-year nursing program that we have to do, at the very end, you get to pick your very last, what we call it, clinical rotation. So you work in a hospital somewhere in an area that you think that you might be interested in working.
That sounds like engineering. You kind of specialize a little bit.
Yeah, exactly. So you dabble.
Exactly. Yeah.
You dabble. You get a taste of it. Yeah. I did emerge for, I guess it was 8 weeks or something. Hated it. Oh. I absolutely hated it.
Were you uncomfortable with that feeling because you thought you were going to do it?
Yeah, because then I was like, okay. Yeah. And now I'm graduating in 8 weeks, and what the heck am I going to do?
Totally. Yeah.
When the thing I had been working towards for 4 years was not what I wanted. And I realized very clearly, like, I will do this if I have to, if I don't have another opportunity. But I was like, I guess I'm starting from square one because I don't know exactly what I want to do anymore.
I didn't know you went through that. That's interesting.
Yeah. So I fell into it by accident. So I went to school in Nova Scotia, moved to Halifax, which is about 2.5 hours away from the town I went to university in. Okay. And needed a job. So I moved there with no job and was living with a friend at the time, one of my best friends out there, and lucked into a casual position. So casual is just that you're not designated certain shifts. You cover sick time and vacations.
And so you're not guaranteed any full-time hours or anything?
No. So you just kind of get put in this pool.
Right. And if they need you, they'll call you.
Yeah. So I was working, it was like an outsourced nursing company where it's not like the main health region that employs you. It's this side private company where so you could be outsourced to any unit to cover any sick call or vacation at the drop of a hat. So you get a phone call and you're like, you're working on cardiac today. Yeah. Enjoy.
Oh, yeah.
Click.
And it could be anywhere.
So I worked on 14 different units in 2 months.
Wow.
It was horrible.
Oh, okay. I thought you were going to say it was a great experience.
It was horrible. I hated every minute of it.
Really?
And it made me realize that I hated jumping around. I hated not knowing where I was going to be on a certain day. I didn't like not knowing my patient population, so I wanted to know more about the specialty on any unit I walked on. Like I walked onto a cardiac floor and they're like, oh, we're going to change the battery in this person's, basically an external pacemaker today. This is your patient. I'm like, I am doing what? Like, no. Yeah, so I don't even know what this is. Never mind how to do this.
And so you're not getting back to what you wanted, which was that face-to-face sort of relationship.
Exactly. I ended up working on the oncology floor a lot.
Okay.
So that's how this all came around. So I was outsourced to all these different units, ended up working on this oncology floor a fair bit, and got to know the manager. A position came up. She offered me a position. So from there, 2 or 3 months into my nursing career, I was now working in oncology.
Okay.
And I was working specifically with blood cancers. So some of the sickest of the sick patients that we'll ever see.
So cancer is awful, but the worst kind is one of the worst kinds is blood?
One of them.
Okay.
So there are a few that we don't see great results yet with current treatments, but blood cancer patients are very, very sick from the minute they're diagnosed all the way through either cure and remission or the end of their life. And so I got like flung into this position where I had never gotten the training to give chemotherapy. I'd never had the training to deal with cancer patients, and I just absolutely fell in love with it.
Really?
Yeah. It just was
that's cool.
Like the best population, these people. And also blood cancers are, there's really no rhyme or reason why they happen. So it's not necessarily like lung cancer where if you smoked your whole life, you have a pretty good chance of developing lung cancer.
Right.
Blood cancers just happen, and we have no idea why, and it doesn't discriminate age, gender, race, anything.
I didn't know that.
So I treated people that were 18 and 98, and everything in between.
And it just sort of happens.
It just happens.
Okay.
Like it's a glitch in your DNA, and your immune system doesn't catch it. Like it just happens.
Right. Okay.
And I just fell in love with that population, knowing that I could have the utmost empathy because none of it was self-inflicted in any way. And I could just 100% be there and feel for them and help them through it.
Oh, okay.
So I absolutely fell in love with it. And then my grandmother, a couple years prior to that, had been diagnosed with lymphoma and passed away from lymphoma, which is one of those blood cancers.
Okay.
So I was able to tie it into more of a family kind of feeling as well.
You had that connection. Yeah.
I had that connection with blood cancers and cancer in general, even though when I was 17 and she passed away of lymphoma, I had no idea I would end up working in that area.
Yeah, but once you were there, you kind of felt that.
But like kind of retrospectively, like my parents and aunts and uncles have all sorts of notes from when she was getting treatment.
Oh,
and I read over them later when this was my work, like my profession.
Mm-hmm.
And it's amazing how I could understand literally every single step of what had happened with her.
Oh, wow, cool.
But at the time, years before, I didn't know it from anything else.
Wow, okay.
Yeah.
So you basically fell in love with it.
Yeah,
kind
so
of
fell into it completely by accident.
Yeah, randomly, but when you were there, you knew this is what you wanted to do.
Yeah, it didn't take me long to realize, this is right for me. This is my niche.
So that's one of those scenarios that not everyone gets to experience, which is kind of cool, where you knew this is what you were sort of meant to do. This is what I can do, and I'm really good at it.
Yeah.
And I believe in it, and I can do it. Okay, awesome.
Exactly.
So you're out east for a while, and you worked with the blood cancer unit and the cancer unit in general, but then you came back to Calgary. Because you were originally from Calgary. And then you transferred to Tom Baker, correct?
Yeah.
And Tom Baker is the cancer center here in Calgary.
Yes.
Is it the only one?
It's the only treatment center in Calgary.
Only treatment center,
So
okay.
we do run some clinics, so meaning that you go see your doctor and talk about, as a patient, you go see your doctor, you get your diagnosis, they follow up with you in a different location. So like the Holy Cross here in Calgary is the other place that happens. But Tom Baker is kind of the institution.
Okay, that makes sense.
For cancer care in Calgary.
Yeah, whenever you hear about it, you always hear Tom Baker.
Yeah.
Yeah, it makes sense. So you've been working there now, 3 or so years?
Almost 2.
Almost 2 years, sorry.
Yeah, it'll be 2 years in May.
Wow, yeah, sorry. I'm getting nostalgic. I remember when you just moved here. It's
I
like
know,
2
right?
years ago.
Yeah, it wasn't that long ago.
Yeah. So what is day-to-day life for an oncology nurse?
So
at Tom Baker or any cancer center, but
there's a lot of different kind of departments within Tom Baker, but I do the treatment side. So I'm a chemo nurse or systemic treatment nurse.
Okay.
Meaning that I give drugs to help hopefully get rid of cancer for patients. And so that's kind of the side that I work in. so I don't go to the doctor's appointments. I have very little interaction with doctors. We do pretty much everything on our own. The nurses, we run our own unit. We call them if we need them. Kind of thing.
So sorry if I may ask. So the doctor prescribes the treatment, and then you take it from there.
Yeah,
is that true?
Basically. Yeah.
Okay.
So the doctor will prescribe the treatment. They'll go through all the testing to diagnose a patient and the follow up and so on. And we get the orders and we take it.
All right.
All right.
Sorry, technical difficulties. Typical to yeah, I cheaped out on the USB hub, so I'm sorry guys, I'll have to buy a new one. So anyway, sorry Rochelle, you're mentioning day-to-day life, doctors sort of prescribe what you have to do and you take it from there.
Yeah.
And
so
you're in charge of basically all the treatment.
Yeah, so we get a set of orders, we process them, we communicate with pharmacy and so on, and everything gets made.
Yeah.
But we're the ones that administer the treatment, monitor for side effects,
right.
And we are the one, or sorry, my particular role. I am really fortunate to have the opportunity to spend a lot of time with the patients, because some of them are sitting there for, some treatments can be as short as 10 minutes, others can be like 10 hours. So we're open for 10 and a quarter hours a day.
Wow, okay.
And some people open and close with us.
Really?
Yeah.
So some people come in for quick, I don't want to say the word quick, I don't want to minimize anything, but sometimes it's quick treatment, and other people are there all day.
Yeah.
Oh,
and
okay.
it doesn't mean that the all-day ones are harder necessarily.
Right,
It's just every drug takes a certain amount of time to infuse or to give and things like that.
Yeah.
So I am so fortunate that I get to spend so much time with these patients, and that's my favorite part, is that you really get to know them, because in the clinics, when people are getting a diagnosis or follow-up in between treatments and stuff, the doctors and nurses that they work with, really, they don't have the luxury of time to spend with them as much.
Yeah.
Which, it just is what it is. It's part of healthcare right now. Like, time is probably one of the hardest things that we have to deal with as far as limitations in healthcare, is how much time one can spend. So I get to spend potentially hours with this person.
Oh, okay.
So my favorite part of what I do is I love to teach. I love to educate and empower patients to understand what's going on in their bodies, to help them cope, and then also to distract, like to talk about everyday stuff. Talk about their family and the barbecue that they're going to on the weekend, and
keep it positive.
Yeah. So it's really a bright place to walk into. It's not this doom and gloom kind of place that you might expect a cancer center to be.
Yeah, that was my impression. It's probably incorrect, but that it would be my impression.
Yeah, there's lots of laughter. There's, we hug our patients as they come in when we get to know them really well, and they often will get to know us too. So they'll ask how your weekend was.
Yeah. So you establish that relationship.
You have a relationship. Like, it's not just healthcare provider patient. Like, you become a little family.
Right. Okay.
And, And that's the best part of working at Tom Baker, especially in the outpatient population, which means they're not admitted to hospital. They go home after their treatment.
Right.
It's all managed on an outside kind of basis.
Okay.
And that's the beauty of it, is it's not, you walk in there and a lot of people say that they found it a lot less scary than they thought it would be. It was a lot more uplifting than they thought it was going to be. That's
probably a big part, or mostly because of the people, right?
Yeah. And it's all just like human relationships. Like, it's finding that person beyond the diagnosis, beyond anything other stuff they have going on in their life, and talking to them like a human being and spending time.
Yeah, of course. Yeah.
So that's my day-to-day life there. That's what I do.
Awesome. Okay, that makes sense. So outside of the treatment, there's a lot of sort of relationship parts with the patients where you support them, you educate them, you keep things positive. Probably not part of your job description, but sort of is part of your job in a way, right? If you want to do a good job.
Yeah, it's all part of it. And not to say that it's all smiles and giggles and all that all the time.
It's still a hospital,
but I like to pride myself in asking hard questions to some of these patients, or to be willing to have difficult conversations with them when they want to talk about it.
Right.
So I'm not afraid to talk to them about death and dying, and I'm not afraid to talk to them about depression, and I'm not afraid to talk to them about how they're going to tell their kids and stuff like that. So that's also, you know, as much as, yes, you stay positive.
You still real.
Another thing we're really good at, and what I try and work at is being honest and being real and talking about the real emotions that go along with all of this that they're experiencing day to day.
Right. And I mean, you have to, right? Like, it's not like it's not true if you don't address it. Yeah. So, I mean, you do this every single day. How do you separate? I mean, so I'm sort of putting my own perspective on it. If I had to deal every day with people's lives and people passing, that would be really hard for me. How does that weigh on you, or?
It's hard sometimes. Like especially when I was in Halifax. So when I was in Halifax working with blood cancers, the stats aren't great. Like, you can look up any stat you want on blood cancers, and they're not pretty numbers.
So most of the time it's terminal? Is that, am I making
many
a stupid
times
statement?
People's lifespan is dramatically shortened.
Okay.
Depending on a lot of stuff. But some do great. But statistically, the numbers are not great.
Okay.
As it stands right now. So I experienced a lot of loss in Halifax, and that was it wore on me more than I kind of thought it would.
Because I don't want to cut you off too much, but you're very, like, I think you have this awesome ability to be strong and be kind of compartmentalize things. And so those two traits I see in you, and yet you still feel that it was very hard. Yeah.
But I think it's important to feel that. As a nurse, if I stop feeling that, if I stop feeling affected, like if I'm not affected by the loss of a patient that I cared for really deeply, like the second I get jaded, I need to get out. I need to do something else.
So it's important. You need
enjoy that sounds weird. That's a weird word to say.
No,
I enjoy that I can still feel that. And I never want to
keeps you human,
right? Like, I never want to just be like, oh yeah, they died, that sucks. Like, I never want to have that kind of feeling about my patients. Like, I want to allow myself to feel those highs and lows.
Because if I could dial it back to what you said earlier, is like, you really care and you want to be front and center. So if that feeling went away, where you didn't care anymore, then maybe something's wrong, or maybe you're not, Okay,
exactly.
and that makes sense.
So it was hard.
You embrace it. That feeling, those feelings you get from loss or whatever happens, you just embrace it. And does it bother you? Like, do you go home? Are you bothered? Like, or can you shut it off? Or I don't want to be insensitive about that, but
I can turn it off a little bit, but I feel I have the luxury of not having to take work home with me, which is nice. I go to work every day.
That's true.
I do my job.
Not that your work is isn't easy, but you don't have to bring it home.
But I don't have to bring it home. Like, I don't have to do anything prep at home. I don't check my emails at home.
That's true, actually. I didn't think about that. You're not on call.
No, I go to work for my 10 and a quarter hours, and I come home, and it's me time. And it's my life.
Okay.
But you carry some of the emotional stuff.
You'd have to if you're a human being, right?
You do. And that's what I'm saying is I would never want to not have that.
Okay.
When I was in Halifax, what I started saying was that it was really hard because I did experience a lot of loss and a lot of people, some of whom were like my age at the time. You know, you never know how your emotions or even your body is going to react when you put another person your own age in a body bag. Like, it's the weirdest thing.
You can't describe that.
You can't describe it.
You don't know until you go through it.
It's the weirdest thing, and you feel very human all of a sudden. And so I was able to separate a lot of that. Like, I don't live in fear of getting cancer. I don't bring that home with me. I don't come home and cry every day.
Yeah.
Sometimes I would. And again, I'm okay with that.
Yeah, of course.
Because I feel like that's part of it that you have to allow yourself to feel.
Yeah, you're a human being. Yeah.
But here at Tom Baker now, because we see a lot of good, I don't exclusively work with blood cancer patients anymore. I work with all types of cancer patients.
Right.
So again, numbers wise, much higher cure and remission rates with the people I deal with now. And I also treat a lot more people. So we see between 100 and 140 people a day, 5 days a week at Tom Baker in my department alone.
Okay, wow.
For treatment.
Okay.
So
you guys are efficient.
Yeah. So like over 700, I don't know what the numbers work out to be, but over 700 patients come through the doors per week. So I don't develop that really intense relationship with all of them, obviously.
Yeah.
But like I'll go home to my family or my boyfriend and some days I just need to vent and cry and be emotional and let myself feel it. And other times it's funny because I'll come home and, you know, how was your day? It was great.
Yeah.
It was a great day.
Yeah.
You know, like, but you
Yeah.
treated cancer patients all day. Yeah. But it was still a great day.
Yeah.
Like
That's awesome.
There's nothing wrong with that day.
That's awesome.
So I am able to compartmentalize it a little bit, but I always want to feel that emotion.
You don't want to get rid of that.
Yeah. I never want to get rid of that.
I think that's an interesting point. Like, even if you could remove that, you don't even want that.
I don't want to.
Yeah. Okay, that makes sense.
I've gone to patients' funerals. Like I've participated in mourning.
Okay,
with their family and their loved ones and coworkers and all that.
Yeah.
You see a lot of, you know, if you're on Facebook or whatever, and if you know any nurses or doctors, every now and then you might see someone post like one of those pictures or memes of, you know, nurses crying in a hallway or something like that. It's the stuff that you don't see.
Yeah.
Because we are the strong ones. We're the ones that are there, you know, helping you through whatever journey.
Yeah, you're in the trenches. Yeah.
We're helping people get through their day-to-day life living with cancer.
And the probably the hardest experience they've ever had to deal with.
Exactly.
Yeah.
But it's a privilege and a pleasure to be a part of their life in that most vulnerable time.
Wow. Okay.
Like that is how I see it. I've always seen it that way.
Yeah.
I just see it as an absolute privilege for me to be able to be there in that time of vulnerability and difficulty.
Wow.
And help them navigate that however I can.
Because you have such a massive impact, right? They're so vulnerable. Again, this is my perspective, but they're so vulnerable that you can be so helpful in that moment.
You could try.
Yeah.
Yeah.
Like it seems like you're in your worst time and you have the power to be like this amazing positive impact if you want to.
Yeah.
Yeah.
And it doesn't mean that you can be a positive impact without necessarily having the results that you want. Sometimes things don't go your way.
Right.
And you know, someone's disease course is not going how we would like it to go. You know, things aren't turning out. But you can still be there then too. You can still be that, you know, beacon of hope and work towards whatever the new goal is. Maybe the goal now isn't cure, but maybe the goal is living with their family at home, or maybe it is you set new goals.
That's interesting.
Maybe it's managing pain. Maybe it's coming to terms with any regrets that patients might have had, or regrets is a strong word. Anything that they want to work on at that stage of the game.
That's interesting. So maybe if one goal maybe doesn't work out, you just change it to something else. You will focus on something else. Yeah. Or you work towards something else. I never thought about that. That's cool. That's interesting.
I do talks for I have done a couple of talks for the Leukemia Lymphoma Society specifically.
Oh, really?
At this event called Journey of Hope. I'm actually doing it again in June.
Oh, you do speeches and like, is it like a learning or is it what?
Yeah, it's learning or it's a conference to celebrate a community of people that are going through something similar.
Oh, okay.
So I'm a support group facilitator for the Leukemia Lymphoma Society. So once a month I run a support group. But on top of that, I also do speaking events for them.
Right.
So I did one in Halifax a couple of years ago, and I'm doing one again in June, and it's all about hope. So I'm not this clinical person who is going and talking about science.
Yeah,
I'm not talking.
That's what my first impression was. Yeah, sorry.
Yeah, like I'm not going and talking about the new treatments that are up and coming or side effects and how we manage them generally.
Yeah.
I'm talking about the human experience. And so the speech that I'm going to be doing in June is all about hope and how you can have hope at every point in a person's journey with cancer.
Right.
From the beginning to the end, whatever that end may be.
Right.
And you sometimes have to change what the goal is, but there's always something to be hopeful for. So even when people are feeling really low and feeling like they want to give up, maybe suffering from depression or struggling with symptom management or whatever it is.
Yeah.
The beauty of what I do and what my coworkers do is we are able to refocus and instill hope in that patient and family for the next step. So even if it's with death and dying, it is to be comfortable and to have really good quality time with the people that matter most. And it's interesting how it changes your perspective on what matters to you.
Yeah, that is interesting. And that's what I wanted to ask you about, dealing with this stuff day to day. And you're so knowledgeable. And I just want to sidebar and say you sound like the perfect caregiver. Because
I am far from perfect. I can guarantee that.
Perfect compared to me, that's for sure.
Yeah, we could do a whole other segment on my like poop stories and stuff that I've had to deal with. So yeah, it's not all this. Yeah.
Yeah, because I know you're smart, a very smart person, and you're dedicated and you care. So you sound like the perfect caregiver. But
I'll take it.
Take it, yeah. So you alluded exactly what I wanted to ask you. What is life for you? Mm-hmm. What's your perspective on maybe the meaning of life or life and death? I don't know what angle. Having done this for most of your life or career, what is important to you in life, and what is death for you?
Yeah. So heavy questions. Thank you for that.
Sorry.
Put me on the spot.
Yeah. Sorry.
So for me, I value relationships above anything else.
That's the most important thing.
That is the most important thing in my life.
Okay.
I think we are all given a certain amount of time on this earth, and where you go after is up to your own opinion.
So do you mind if are you very religious, or?
I am religious. Yeah.
Yeah. Okay. Sorry.
So I grew up Catholic, and I do believe in when you die, you go to heaven.
Okay.
So I believe that when my time comes, like it's not just over. Yeah. I believe that I'm going to go to heaven and be reunited with the people that I loved the most throughout my life. That's what I believe.
Okay, fair enough. Sorry, I cut you off there. But you were saying everyone has a limited time. So
everyone has a limited time, and it's up to you what you do with it. Right. And I think it would be easy to fall into doing what I do. I think it'd be easy to live in fear.
Yeah, of course,
these horrible diseases that we deal with, whether it's cancer or whether you just as a nurse, like I know of heart disease and ALS and MS and like all these scary things that you see on the news or you watch in movies, or you know what it looks like. You know, you don't want to end up like Stephen Hawking, and you don't want to end up, not able to, or dementia, use your brain and communicate and things like that. So relationships to me are by far the most important thing.
Okay.
Money's not that important to me.
That's awesome.
It sounds stupid.
Because I think it cripples a lot of people, myself included.
Yeah, but it's like, I know that anybody in the business world or anybody who maybe doesn't work in healthcare, or maybe some people that do work in healthcare, probably, especially in our generation, we have goals. We have goals of how much money we want to make by the time we're however old, and you want to go through these life steps and tick the boxes.
For sure, yeah. You're
and I still have the boxes. Like I still have, I have plans and I have goals and I have things that I'm wanting to do with my life that require money.
Yeah.
But I saw this thing on Instagram or something the other day, and it was this picture of these guys in business suits, and it had this caption that says, keep working until your bank account looks like a phone number.
Oh, aggressive.
Yeah. And
That's
I'm like,
not what my bank account looks like.
Yeah.
Me
neither.
I think it's 911 phone number. It's a 3-digit phone
It's a 3-digit phone number? That's all you need. Yeah. That's all you need, really.
It's enough to buy pizza.
As long as it doesn't start with a 0, it should be fine. Yeah. And I actually reflected on this for some reason. It hit me, and I was like, I don't want that at all.
Oh, that's how you...
all.
So you didn't reflect like I should. You said, no, I don't want that.
I said that sounds like a horrible idea.
Really?
I don't want that.
Why?
I do not want to have my life revolve around work and grind and grind and grind until I reach this goal of having a 7-digit bank account.
This magic number.
and then I'll be happy. No.
And you know what? You probably wouldn't be happy.
No.
Yeah.
And it kind of makes me laugh because I know that making a certain amount of money might be the goal for a lot of people.
Well, it's what society tells you should do.
Of course.
Yeah.
And especially, it is.
Sort of, yeah.
But for me, it doesn't matter at all. If I am able to work and make money to the point where I can live the life I want to live, which is pretty simple and pretty modest for the most part. Like, of course, I want to travel and do things like that, so that requires some money.
Yeah, but you enjoy something like you like cooking and
the simple things are what matter more to me. So relationships, spending time with family and friends. My absolute favorite thing to do is have people over for dinner. As you guys might know.
Well, just to cut you off, sorry, Michelle's a fantastic cook. Fantastic. So having people over, it's really a privilege to the guests. It's not even for Regine.
It's my favorite thing.
Yeah, I know. You love it. It's awesome. And we love it too.
Yeah. It's a mutual benefit for sure. Yeah. But if I could do nothing else and just spend time with those people that I love and feed them and express, your love and caring for them by bringing them together and having good conversation and sharing joy, like that amount of time that we're all here, it doesn't matter how much time, because if we're spending our lives focusing on the things that matter to you,
then like the end is going to come at some point.
It's going to come at some point.
But it doesn't matter because you enjoyed it.
Exactly.
Yeah,
and so it's like that whole I will work until I have a 7-digit bank account.
Or I'll be happy when I retire, or whatever it is.
Whatever it is. Yeah. Like, I disagree with that to my core.
So you firmly believe that you should basically sort of enjoy every day. Like, you should do what you want or what makes you happy on a daily basis, not plan for it on the outside.
For the most part, the whole cliche, live every day as if it's your last and all that stuff. Yeah. We can't all do that. We can't do that because we need to be responsible.
We still
adults,
have to go to Costco and stuff. Yeah.
Oh, Costco's huge. Yeah, we have to go. If we're going to buy in bulk, we have to live long enough to use it all, right?
Yeah, exactly.
Like, it just is
that's part of
it. Yeah. But, I just think that money is not everything to me. Bringing people together, spending time outdoors. Work is very fulfilling for me too. Like, I feel a lot of sense of purpose and fulfillment in my work.
Yeah. I think not a lot of people get that. Sorry, I'm always cutting off.
That's okay. But it is also a means to an end. Like, I know I don't want to work every day of my entire life.
Yeah. And you probably feel fulfilled through your job, which a lot of people don't get that. Yeah. And I think, like, my perspective on you is like you're very centered and you feel like you're sure about what you want. I think part of that comes from, and correct me if I'm wrong, I think part of that comes from like you actually enjoy what you do.
Yeah.
Actually, Thomas is like, he does what he really loves and he's really, really good at it. I think that's part of why he's fairly content, unless he has some crippling issues that I'm not aware of. But and I see that in him and I see that in you, because I think if you do what you enjoy, you're getting back to what you said before, where you're happy and wholesome, for lack of a better word, almost on a daily basis. Yeah. Because your 9 to 5 or whatever it is you do is fulfilling.
Yeah. And that's the thing, is even a day at work, oh God, the alarm goes off.
Yeah.
You have to get up.
It's never perfect.
Like, it's never perfect, but you can come home from a day of work and be like, it was a good day.
Yeah, of course.
Like I said before, I treated cancer all day long, but it was still a good day.
Yeah. That's awesome.
Yeah, and focusing on what makes you happy. Like, of course, you have to decently responsible in some of those things.
You still need a bank account, and
you have to be
pay for electricity.
A contributing member of society.
Yeah.
But I just think if you can find happiness in day-to-day things and make sure that you always bring those priorities into your life on a daily basis, not years down the road when you're retired, then I'm going to travel, or then I'm going to spend more time with my parents, or, I'm busy this week, so I'll catch up with that friend next month, or whatever. It just...
To you, that doesn't make sense.
No, just do it now.
Yeah, I agree. I am more like getting closer to that. I'm not where you're at, but I agree more with that now.
Yeah.
One of the biggest struggles I have or what I'm trying to figure out in my life is how much effort do I put in now for the future, and how much effort do I put in now for the present? Because let's say you work balls to the wall for 20 years, don't spend a penny. I mean, you would set yourself up nicely for the future, right?
Sure.
Technically, let's say that.
Totally.
But the future might not come. And what is what happens when you get to that point? Like, are you happy?
Yeah.
That's one of the biggest things that I have trouble figuring out is, do I take if you're talking about money, do I take the dollar today and put it in my bank? Or do I go and buy an avocado? Because I like avocados.
They're expensive.
They're expensive, but they're awesome. Yeah. But that's what I'm saying. Because I don't need an avocado in my meal.
This is such a funny example, I guess.
But I like avocados. I also like cilantro. Hate on me now. I love cilantro.
I love it too.
Yeah. Well,
you're welcome for dinner anytime. Cilantro and avocados. That's all we're gonna have.
Yeah. So that's what I struggle with, and I don't know how to figure that out. And it seems you're so sure of it, and I think that's awesome, because I wish I was sure of what I should do, because
it might be a bit of an illusion. Like, I might sound like I have it all figured out, but I don't at all. Like, I struggle with the same things, but I think what you can do to help navigate that is really reflect on how you define that happiness.
Oh, okay, that's perfect. Yeah.
So
what really makes you happy? Yeah.
So, if you're talking about saving money versus spending money, you are putting an emphasis on that money being a direct player in your happiness.
You're right.
You know what I mean?
That's dangerous.
But I think that if everyone just takes some time to reflect on what actually makes them happy, then it's not as much of a, like, you can still consider saving money and spending money.
Oh, yeah.
But there's so much more than that defines if you're happy today or tomorrow or in the future.
Yeah.
Like, I think that if you break it down to simpler things, instead of, getting stressed about, I'm going to work balls to the wall for 20 years because then I'll be happy when I'm done.
Yeah. It sounds dumb now that you're repeating it.
You know what I mean? But I think that's such a common mentality. Yeah. And I think that it's really, really hard to overcome that. And if I didn't do what I do, I think I'd be in the exact same shoes as you.
Right.
Because I guess I think I define happiness for myself differently than I used to.
Right.
Because of what I see every day.
Right. Okay. Yeah.
And so I can be happy even if I have like a brutal day at work and bad things happen and nothing goes my way and, you have a bad hair day and you get a parking ticket and all this stuff happens.
It compiles. Yeah. Whatever that bad
But
day
it doesn't matter, because at the end of the day, I come home to people that I love.
Yeah.
And I can walk and talk and go home and call my mom if I want to, because she's alive and well and all these things. Like,
you can go cook. Like, you can go get any grocery you want.
Exactly.
And go make whatever you want.
I'm not restricted. I don't have to, eat a can of soup every single day or not eat a certain day because, that's not my situation in life. Yeah. So I think that even on the worst days, I can be happy and I can find joy in no matter what gets thrown at me.
Yeah.
Because it's not necessarily defined by the negative parts of that. There's always still something good.
Yeah. Yeah. That's an awesome way to say it. There's always something good. I wish I was more like that. I try to be more like that. Yeah. But because there are days I come home and you have sort of thing like work didn't go well. I don't know. I had a rant, like I got a speeding ticket or whatever it is. But I have to constantly remind myself, like, I have such amazing friends. I have an awesome girlfriend.
She's really cool, I hear.
She's cool, yeah. She's self-proclaimed super cool.
Yeah.
But I do have those things. Like, that's not, I'm not lying. Like, I get to sit here and talk to you.
Yeah.
How many people get to do that? And you agreed to it too. like
I was tricked.
There's no chains on her chair.
Yeah. I can leave freely at any time.
Yeah. And I think I've gotten closer to that. Mm-hmm. And like, I have my health too.
Yeah.
Like, I can go walk so I won't ramble, but that's really, really important because it has helped me to, and I use you as an example a lot of times, has helped me to not worry about those other things.
Yeah.
Like, who cares?
Yeah.
Yeah, like, yeah. Sorry,
I had a really cool day that I'll never forget, and it was not this past August, but the August before. My bike got stolen from work.
Oh, I did hear the story. Yeah,
Yes.
I felt so bad for you.
Yeah. So I had
that?
this. So I rode my bike to Tom Baker because I'm trying to be like a healthy,
like you're doing good
human
things.
being.
Yeah.
You know, reduce the carbon footprint and all that crap.
All that
And
crap.
and so rode my bike to work. I had like the worst day at work where people were having allergic reactions and all this junk that had to deal with it. It's just extra stuff that's more stressful than you would like it to be.
Yeah.
But at the end of the day, I was going to Taste of Calgary, which is one of my absolute favorite events
Yeah, yeah.
in the city.
Yeah.
And I actually met up with you that day, that night. And it's going to Taste of Calgary, so I was all excited. And it's, this food event in Calgary, if people don't know about it.
Yeah.
You get to taste all these awesome samples from different restaurants and stuff like that. One of my absolute favorite things to do in the city.
Yeah, yeah.
So I was so excited, and I go down, and my triathlon racing bike, like my beautiful bike, had been stolen.
I remember this. Yeah.
And I remember sitting there. I was sitting on a picnic table outside of Tom Baker, waiting for my dad to come pick me up because I had no other way to get home.
Your transportation is gone.
My transportation, And I sat there, and I could have been cursing and swearing and pissed off at the world.
Easily in a bad mood, yeah.
But I was like, that's okay. I'm meeting up with friends, and I'm going to Taste of Calgary tonight, and I'm really excited about that.
That's awesome.
And
That's
I went home to Trish, your girlfriend, and we were talking about it, and I think everyone was more mad about it than I was.
Yeah, because Trish was really upset.
Trish was really mad.
She's like,
you were.
Why would that happen
You're
to
like,
Rochelle?
"That's
She's
insane,
such a good
right?"
person.
Exactly. My dad, he was like, "Did you file a police report?"
Yeah.
Like, well, yeah.
Yeah.
But he's like, "Oh, well, do you want to come over for dinner
Yeah.
and, have a beer and take the edge off?" I'm like, "No, I'm okay.
Yeah.
I'm gonna go to Taste of Calgary, and I'm gonna have my lovely evening."
Yeah.
So even when all of those things went wrong that day, it just didn't matter.
Yeah, and it goes back to what you said was most important. You have these amazing relationships with people. You knew you were going to go to Taste of Calgary.
Yeah.
I mean, I was there, so maybe that was a wild card. But,
that
but
was the worst part of my day, actually.
Yeah, for sure. She actually was going to be happier, but she knew I was going to be there. So
put a little damper on this.
Yeah, but you knew that what was most important to you, which is your relationships with people, was what you were going to take part in later that day. Yeah.
Yeah.
That's awesome.
Did you get the bike back?
No.
Oh, sorry. Yeah, we should.
I never did. But the worst part about that was that I did get a call. I think Trish was there for this too. I did get a call from the police saying that they thought they had found my bike.
Oh, yeah.
And they asked me to describe it.
This is awful.
And they went on to the description of my tri-bike, and I was so excited. And they're like, yeah, it kind of got manipulated a little bit. I think they changed the colors and whatever, but, And the guy probably told me more than he should have as well about the implications and how they found this stolen bike. And he was like, yeah, it's a white bike with black writing and teal handlebars. I was like, no, mine was a black bike with white writing and teal handlebars.
The saddest story on
and
earth.
It was like, I was so excited, and it just came crashing down. So no, I never did get my bike back, and now I ride this crappy little mountain bike, but that's okay.
All right.
That is okay.
Yeah,
because
that's okay.
You have lots of people
because I don't care.
Yeah, you have lots of people that love you.
fine.
Yeah. I was just, sorry, I don't know what to say. I just think that's so awesome. I aspire to be more like that. I think that's all I wanted to pick your brain on.
Yeah.
I always try to end the podcast by complimenting the person. So I'm going to try that now.
So you're going to try really hard to pick
3,
something up.
2, 1.
Fire away.
But I want to say, Rochelle, first of all, thank you for coming. And this is a heavy topic, right? And it's not easy to talk about. And it's difficult maybe to put into words those deep emotions. But so I appreciate you coming. Like I said, I'm not lying when I think you're the perfect caregiver, because you're awesome. You're smart. You care about people. It's fantastic. And you said the most important thing to you was having good relationships. Well, part of that is because you're fantastic too. So,
well, thank you.
Yeah,
I appreciate that.
I aspire to think more like you, and I'm glad we got time to sit down and chat. So thank you.
Awesome. Well, thank you for having me. This is